Well, this is Glenn Loury at The Glenn Show at bloggingheads.tv, talking with my friend and colleague Harold Pollack at the School of Social Service Administration at the University of Chicago, a healthcare policy expert. And here we are this morning, the morning after it was revealed that Jonathan Gruber, MIT professor of economics and healthcare guru and one of the leading architects of the Affordable Care Act, Obamacare, it has been revealed that in comments that he made at an academic conference, he acknowledged that the design of the healthcare law had intentionally been obscure or non-transparent in ways designed to not alert the public to the full effect of the law because, by his reckoning, it would not have passed. And he went on to say, chalk it up to the, quote, stupidity of the American voter, close quote. But in any case, that's how we had to play it. That was Jonathan Gruber's remarks. They have been made public. They have been seized upon by critics of the healthcare law. And because, Harold Pollack, you were actually in the room, if I am not mistaken, in Washington when President Obama signed that legislation, because I got a photograph from you inside of that room of that signing. Admittedly, you were in the back of the room, but you were still in the room.
I was about as far back in the room as you could get. I was sitting on the windowsill in the extreme far back of the room, so I just want to make that completely clear.
All right, anyway, what do you have to say for Brother Gruber and for this general issue of the stupidity of the American voter and the honesty with which this massive piece of legislation was sold, or dishonesty with which it was sold to the American people?
Well, first of all, my brother Jonathan really, it's hard to pack 53 seconds of stupid as efficiently as he did. Now, I should say that everybody criticizing Jonathan Gruber, there's a 53-second clip of them being equally or more stupid than Jonathan was. And I thank God that there's nobody following me around with a camera, watching every second of my public utterances to find stupidity, because who among us hasn't done that? So, but I do think that what he said was almost entirely, although not entirely, wrong. I think that he's wrong in a couple of ways that I want to point out. First of all, I think that the comments about the stupidity of the American voter. Now, of course, we saw 53 seconds of an answer, so what we watched was a very tightly edited clip without context. So I think that's another thing that that has to be borne in mind. The typical voter is not at all stupid. I think people are ignorant, and that's just a fact about the American voter. If you look at, the fact is most American voters cannot identify which political party controls which House of Congress. So I mean, there's no question that voters are incredibly ignorant, but not stupid. And if you watch, if you listen to sports radio, you get a good sense that the average person is actually extremely intelligent about stuff that they're interested in and engaged with. And I think it is extremely condescending and damaging to treat people as if they're stupid, and I completely reject that. I actually think Jonathan's also wrong in that he said if people understood that the purpose was for healthy people to subsidize sick people, that people would have voted against this law. I actually think people understand that perfectly well, and they support that. And I think we're selling the average person short if we downplay the moral case for what ACA was trying to do, which is to protect people who are sick, to subsidize people who can't afford health insurance, and to do the other things that ACA has actually done. So I think that he was correct that there are a number of issues around the framing of particular provisions of ACA where politics, I hate to break it to you, but politics did play a role. And for example, it was important, I think, for the political case for ACA that the individual mandate not be framed as a tax on the healthy. And in some way it is, in the sense that you need to have young and healthy people purchasing insurance to maintain an adequate insurance pool. But anyway, I've been talking a long time. I'll let you enter the conversation.
No, I was just saying, yeah, of course it's, quote, a tax, close quote, on healthy people, in the sense that the whole premise is a kind of cross-subsidy from the healthy to the sick. It's called social insurance.
Well, no, it's actually, it's not just called social insurance. It's also called, I mean, it's any insurance market in which people want to be insured over time. You know, I think Mitt Romney actually was very eloquent in supporting the individual mandate as supported by his advisor Jonathan Gruber in Massachusetts, where he said, you cannot have a system where people are young and healthy and they wait until they get sick and then they show up to try to get insurance. That doesn't work. And so you can, whether we want to call it a tax or not, it's really an insurance pool that has any kind of element of time and any kind of protection for pre-existing conditions has to include some provision like that.
Here's what I would say. I would say insurance companies are in the business of spreading risks. Okay, risks are defined as the potential of some kind of loss, not yet manifest, to which people are subject to. Mm-hmm. If someone comes in sick, if they come in and they're sick, providing them with coverage is not, quote, insurance, close quote. It's a transfer because we already know that they're sick. People will wait until they're sick to claim the insurance only under the condition that the insurance is available to them on terms as if they were not sick.
Yes.
So that's what I mean by the distinction between social insurance, where we say sick or not, we're going to take care of you, and private insurance, where we say there are a pool of people, some of whom may get sick. There's a certain risk of that. We will calibrate the price of the insurance policy based on the extent of that risk and charge accordingly. Somehow I remember insurance companies, and I'm not a flack for the insurance industry, being demonized because they wanted to take note of the fact that a person had a pre-existing condition. That was marketed as if it was the most evil thing in the world, when to my mind all it meant was they're selling insurance. They underwrite the policy based upon the nature of the risk. A pre-existing condition is relevant to that. If we decide we don't want people to suffer by having to pay more who have pre-existing conditions, then we ought to be honest and say what it is that we're doing, which is that we are sharing the burden across ourselves from the healthy to those who have the pre-existing condition.
Well, it's a little bit more complicated than that. I mean, I think you and I actually totally agree on and understand the basic mechanisms of insurance markets, but I think the way that you're explaining it is not quite the way I would explain it. First of all, what insurers have actually said is if you want us to not discriminate against people with pre-existing conditions, then you have to have the individual mandate, because you're basically because it's up. We will run a private market the way you tell us to run it. But you have to allow us, if you're going to force us to not charge people based on their expected cost, then you have to give us the protection of the individual mandate so that we can maintain a risk pool. The fact is, within our employer-based insurance, you and I have substantial protections against pre-existing conditions because I work at the University of Chicago, and I effectively operate under a situation of an individual mandate, and also a situation where there's a lot of subsidies that go from the healthy to the sick. So it is not. You could say that within our own organization we have our own little social insurance program, although of course it only applies to people that we choose to employ. But in fact, the private insurance market includes these elements because people don't want to buy insurance on a spot market. They want to buy insurance that works over a period of many years, and they want to be able to buy a private contract which gives them the protection that next year I might be diagnosed with prostate cancer and I don't want my health insurance to go up to $2,000 a month if that happens. So it is. I think you're drawing a distinction between social insurance and private insurance, which really runs over some of the important distinctions about what we actually want private insurance markets to do. And in an era where diagnostic technologies and genetic testing and so on is getting more and more precise, I think that fewer and fewer of us actually want to be able to have an insurance market which is a really spot market based on my individual risk rating. That just doesn't do what we want.
I accept that, and I accept the idea that a corporation or some other large aggregation of people who will be more or less healthy creates a context if we can rope them all into the same policy setting in which individuals are protected against this spike. Mm-hmm. I find out I've got prostate cancer, now my policy is $10,000 a year instead of $1,000 a year. I take that point. Let's talk about some other aspects of this brouhaha occasioned by Jonathan Gruber's remarks. One of them is elitism. Okay, playing right into the Republican hand here. A bunch of pointy heads who think they know better than everybody else. Not only does he call the American voter stupid, let's take your friendly amendment and say that they're ignorant, not stupid, that they're ignorant, they just didn't know. A public official, upon discovering that, chooses not to educate them. They're ignorant, let's educate them. Chooses rather to manipulate them on the basis of his knowledge of their ignorance. This is kind of, I think, what you have to say that Jonathan Gruber was saying. So where does that leave us when we are confronted with, I don't know, your median voter in Arkansas or Illinois, for that matter, who has a suspicion of his government, who was told by the president when he was selling this policy, if you like your insurance, you can keep it, which has proven to be false in a major way, and who learned now that the experts who were behind the curtain crafting this massive piece of legislation had contempt for them and chose to use their ignorance to foist on them something which he believed himself they wouldn't have agreed to if they had fully understood it. What do we say about that?
Well, I think the elitism charge, first of all, I think that you shouldn't say anything about voters that you're not willing to say to their face. And I think it's totally appropriate to say to people's faces, hey, you know what, the level of public ignorance about this is a huge problem. I don't actually think that the ACA, that people were sold a bill of goods on the ACA. And in fact, I think President Obama explained quite explicitly the structure of this law quite honestly. And there's the if you have your insurance, you can keep it thing. If you like your insurance, that was so dramatically overblown. And the fact is that there's a tremendous level of churning in the market, and lots of people are gaining and losing their insurance all the time for reasons that have nothing to do with the ACA. And once healthcare.gov was actually up and functioning, I would say that most people, not all, but most people who had those complaints, it turns out either they were the beneficiaries of policies that wouldn't have actually helped them if they were sick, or that were excluding other people because they were at higher risk, or in other ways that the story was was more benign in many cases, though not all, than the critics complained. The fact is that the law, as it's actually been working in 2014, has done what the president told people it was going to do. We've got insurance for 10 million people who would have otherwise been uninsured, except in the states that are screwing their poor people by declining Medicaid. What we see is what was promised has actually been delivered. Now, the problem is that the people who are really being helped are the people in the bottom third of the income distribution, and the people who are complaining are generally not. And it seems to me that the president, I have not seen any piece of legislation that was more publicly dissected than ACA was over many, many months and months and months and months. And you compare this to the criticisms of ACA, which don't forget included everything from death panels to claims that no one was going to sign up, to claims that no one was going to pay their premiums, to a series of really specious criticisms that turned out to be unfounded. ACA, it has come in cheaper than it was forecast. It's insuring a lot of people. Hospitals in states with the Medicaid expansion are reporting dramatic reductions in the cost of uncompensated care. One of the ironies of this whole thing is it's unpopular. There's no doubt that ACA has been a political albatross, but it's actually, in 2014, what's actually happening on the ground is quite impressive. And the only...
Excuse me, Harold.
Go ahead.
Excuse me. Yeah, let me get a word in here. Precisely. It's unpopular. We live in a democracy. Precisely. Okay, so I'm still back to the man behind the curtain, manipulating the public, knowing better than the median voter knows what's good for him, and putting something forward that couldn't be sold in an honest way.
I think it was sold in an honest way. I just think Jonathan was completely condescending and wrong in that little 50-second clip. I think it was debated. We got 60 United States senators who supported it, passed by a wide margin. This was a debate that's been going on for decades. I just don't think that it was dishonestly sold to people.
So you think he's wrong when he says, I've watched the tape, Harold, when he says it would not have passed. No, wait a minute, you just said this yourself a moment ago in this conversation. If the mandate had been framed as a tax, it would not have passed. It is a tax. I mean, we can pull out the dictionary. And therefore, the framing, the decision is, an artful, this is politics. I understand that this is politics, but still, I mean, I can't get away from this fact that we know better than the people out there know about what it is that's good for them. The law is unpopular. Here we are, 6 years down the pike, 5 years down the pike here on this, and the law is still unpopular, resonating. People still getting voted out of office because of it, and albatross can't be defended overtly.
I didn't say it can't be defended. I said I should say, by the way, it wasn't defended overtly. And I think in 2016, what we will see is, Mitt Romney lost the 2012 election in part because he opposed health reform. And actually, a lot of voters voted for Obama because they supported health reform. So I think that we have a midterm electorate which is disproportionately older and whiter, and in states that was on a map that was very unfavorable to the president. And Obamacare definitely hurt the Democrats in the midterms. There's no doubt about that. I don't think that we will see the same thing in 2016.
I guess that's the only thing you can say at this point, my friend.
No, but I think that we should. I think it is completely correct to criticize Jonathan for the elitism in that comment. But I think it's actually wrong in the sense. Don't forget, ACA not only passed; it passed with a supermajority over the threat of a filibuster, and it's something that it was a big issue in the 2008 election. It was a big issue. It's been a big issue for decades. And in fact, on the ground, I think as people see it working, one of the ironies is all these people in Kentucky who voted against Obama and who are actually benefiting from the Affordable Care Act. I mean, I do get the sense that if Obama went and just resurrected people's grandparents from the grave, a lot of these same people would say he's the worst president in American history. I mean, it is, a lot of this has to do with what people think about Obama, not what people think about the health insurance exchange in their state or whatever the issue is. I do think that we should be arguing straight up about health reform. One of the things that I find very sad about this is, in order to get the thing passed, it did have to be unbelievably complicated because it had to pass through all the hoops of the incrementalism of American politics. When something gets that complicated, there's two consequences. One is people don't like the complexity of it. It inherently becomes a very forbidding Rube Goldberg kind of thing. And the second is that it becomes harder to just explain with clarity the simple principles that make health reform so important. If we had Medicare for all, it could never have passed, but it would have actually been easy to explain. We could have said, now everybody has an insurance card. We're going to tax everybody to pay for it. And if you show up at the doctor, this is, you show them this card and that's how they pay for it. We can't do that because it disrupts too much about the existing health insurance arrangements that we have now. But it would be easier to explain in a clear way. And we're sort of in this catch-22 where politics pushes us to develop this Rube Goldberg machine, and then people say, hey, you've got this Rube Goldberg machine, I hate that. Does that make any sense, what I've been saying?
No, I understand what you're saying. As you put it earlier in this conversation, I might have put it another way. People inherently distrust and overreach from government. Some stuff that needs doing can be done directly, but then the people would reject it. When we try to do it indirectly, we end up with a lot of hundreds and thousands of pages of law, a lot of hundreds of thousands of pages of regulation.
The midrash, yes.
And a lot of bureaucratic overreach, and people don't like that. But I mean, someone could argue, yeah, and with good reason they don't like it. I mean, a conservative would argue, yes, this is massive government overreach. If you can't get the thing through this year, then wait until next year, but do it the right way. Don't do it in this.
Well, a lot of those conservatives have one thing in common, which is that they're not a cancer patient sitting there worried about losing their house. And it is certainly true that a lot of Americans dislike government overreach. It's also true that a lot of Americans would like to see a single-payer system, and a lot of Americans would like to see government do more to help people. And We had.
Harold, I'm afraid, you guys. I'm sorry to have to put it, aren't going to learn anything from the political debacle that has been precipitated here. You're dug in. You're not willing to reevaluate the wisdom because you're so convinced of your righteousness. I mean, look at that last comment that you just made. Senators are not dying from cancer.
No, I'm saying that people who are criticizing ACA and say, you should just wait another 20 years to do it the right way. I think I'm not willing to do that. I just think there's too many people who are suffering, and we did this messy incremental thing that is imperfect and that it has some real political vulnerabilities, but that's actually helping millions of people right now.
Nobody's disputing that it's helping people, Harold. Legal vulnerabilities as well. I'm sure you're following the case that's at the Supreme Court right now. The question about the fact that some states have not created exchanges and whether or not the subsidies necessary for low-income people to purchase can be provided by the federal exchange in lieu of the state exchanges, which don't exist in some states, when the law clearly states that state exchanges will supply. Now,
the law doesn't clearly state that, by the way. This is a completely BS legal challenge, and I think this just illustrates no matter what we did, it would have ended up at the Supreme Court, because what's leading us to go to the Supreme Court is the degree of polarization, both in the legislative process and in the judiciary. I assure you, if we did a Medicare for All law, first of all, which would itself be incredibly complicated. The single-payer folks never actually wrote an elaborated law that would explain what that would be. And the fact is, you'd have to upturn ERISA, you'd have to do incredibly complicated things to have a single-payer system that would have generated their own constitutional challenges. So I actually think that this current case in front of the Supreme Court, I just think it's a pretty disgraceful invitation to judicial activism, and I actually don't think that I think the point is taken that there's a lot we can learn about doing complex social policy. I think that what the current legal challenge is about this sort of scorched earth opposition to this thing, and how it's gone to the more and more outlandish lengths to try to bring this law down. And I'm completely uncompromising about this current law case. I just think it's a travesty.
We'll see what the 5 justices of the Supreme Court think.
Yep, we will.
And 58 Democratic senators, was it down to, what do we got now, 44, 46? Yeah. That hasn't got anything to do with the public reaction to the Affordable Care Act and similar moves. That's all about people hate Obama even if he can raise from the dead.
Well, I think there's a couple things.
I mean, we can't learn anything?
Well, we can learn a ton of things, but I think that sometimes you do things in politics and you get beat. And the fact that you got beat doesn't mean that what you did was wrong, and it doesn't mean, it may mean that you should do something in a more politically effective way in any number of ways. But I think that, I think we have other problems in American politics that are deeper than ACA. I do worry, by the way, that no president of either party will ever again try anything this big. If you think about, say, the climate change challenge, or if there were Republican issues, say, fixing Social Security, and you imagine that you're the chief of staff to the president in 2028, and you say, we got this really big climate change problem, and we have this, it requires this massive and messy legislative solution. That president is going to say, I remember this thing called Obamacare and how it sucked up all the oxygen of the Obama presidency. I'm just not sure I want to do that. And I worry that our democracy is becoming very sclerotic and that we're not capable of doing big things in the way that we need to be.
You don't see any self-inflicted wounds here? This is just the nature of This is just the nature of the universe that we live in. Nobody can get anything done because Obama fucked this one up.
I think that there is. I think there are self-inflicted.
The rollout of the exchanges. The rollout of the exchanges. Say. I mean, just to pick.
Well, that's the catastrophic self-inflicted wound. I think that's a completely fair. I think you're completely fair to criticize that as both a political and a substantive managerial failure. I mean, I agree with you that was basically the Republican critique was shown to be right in a very damaging way. about the effectiveness of this rollout. And the fact is that now, and I think that's a completely fair criticism. Now, the fact is that it took them about 6 weeks to fix it, and after that, I think that it's worked admirably. Ironically, I think what got us through that was that poor people are used to things that don't work, and that people who really need health insurance were able to bear with the process while it was screwed up. But I think you're right to criticize the rollout of healthcare.gov. I think that really was I think that was a very serious failure of President Obama as a manager and of the federal government's procurement of information technology. And I won't, and you don't get a second chance to make a first impression. I think that was a very serious, politically damaging error. Does that respond to your? I mean, I don't know what else to say. That was a complete screw up.
No, there isn't anything else to say.
Yeah, no, I mean, and I think that was. Yeah. I think, by the way, that was part of why the midterm election went as badly as it did. Most people are not personally affected by ACA. All they see is sort of they knew that healthcare.gov was all messed up, and they don't really have any way of knowing a lot of the things that I'm bragging about that are on the ground accomplishments of ACA. People have no way of really seeing that, but they did see that the government couldn't get a website to work, and which is pretty baseline, and of course that's devastating.
Okay, Harold, we're going to have to sign off. We agreed we're going to keep this short. I've got a meeting.
Okay, hey, nice talking to you, Glenn.
So you get the last word. Take care, my friend.